Good afternoon, everybody. For those of you that know me, you know me. For those of you that don't know me, I'll introduce myself. My name is Beth Cohen. I am a clinical and organizational psychologist. Um, uh, I have the great honor, actually, and pleasure of traveling the nation and speaking and meeting thousands every year of human service professionals, as well as public service, all of public service, actually. I work a lot uh, for not only county government, for also state government, and one of my main areas actually is workforce health and well-being specifically. I even work on a national initiative out of Washington, D.C. on this topic. My other hat that I wear is a darker hat, and that hat is I am a mass trauma expert. I'm a violence prevention expert, which is a professional threat assessor, and I'm a mass trauma expert. So part of what we're talking today, I've never done a pandemic. I've been helped communities and helped government sort of address and help communities recover from disasters like fires and earthquakes, mass murders, terrorism. But a pandemic, I bet you for you and for me, is probably our first, unless you guys were alive in 1918 when the last one happened. Otherwise, my best guess is that we're all in this together. So I'm going to just sort of give you an idea of what we're going to talk about. In between sort of all of this, I will stop it for a moment, and if there's any, please feel free to chat if you would want to. Any questions you might have. There's a lot of you, so we might not be able to take all of them, but certainly we can try to take a few. And I'm already seeing some, I apologize, but this is not a leadership, but we are going to talk about the dilemmas during the pandemic and what happens to you if you guys are leaders and here in, some of you might be supervisors, but also what it is like to be on the front line and the dilemmas that you guys are experiencing. We're going to talk about managing daily life, the psychological and social impacts of this pandemic. And if you take a look at what I put, I've written denial and shock. And for those of you who know the Kubler-Ross stages of grief and loss, you will know that that comes from the stages. And at the other side of it, I put reconciliation. So I made it a little different than those stages. But one thing that we know is that many of us are right now grieving. We are grieving the loss of for some, their innocence. That something like this could happen is beyond for many, especially some of our younger population. We are grieving the ability to have the freedom to come and go. We are grieving some family members who are sick. I've had a number of counties that I've been working with this week and last week that have already lost. Unfortunately, they've lost not only have they had deaths, but some of those deaths directly impacted the county service providers specifically, where they had to go into quarantine. I mean, we are all over the place emotionally and psychologically. So I will have a chance to talk about that. We're also going to examine some maladaptive behaviors because that's what we do during times like this. And I hope you don't mind. My background is in social neurosciences. All my postgraduate work has been in the social neurosciences. So I'm going to talk today about what happens in the brain and why it is that we are experiencing what we are experiencing, why it is we're even reacting or responding or feeling the way we are feeling. So we'll have a chance to do that. And of course, the very, very important is looking at psychological immunity, resilience, and then what they call in my business post-traumatic growth. I'll tell you one of the reasons why I've created these presentations. My goal is to not only educate and to hopefully normalize some of the responses and reactions that you might be having, that you might be seeing in your family, in your colleagues, even in your bosses, whomever you're sort of coming in contact with. It's not only important to understand it, but it's also important to be able to take some steps to try to maintain your own resilience during this period of time. My goal is that if we can really gain an understanding and have strategies on what to do, there's a likelihood, a high likelihood, that there will be less post-traumatic stress disorder on the back end of all this. So I saw a poll yesterday, and the poll, one of the questions on that poll was, you know, how many of you know or are experiencing mental health issues as a result of this pandemic? And 38% responded yes. So we know that it's really affecting, really affecting our population, and not just United States, but globally. Can you be so kind for me is to just, I'm going to do a poll real quickly so I know who exactly is in the room. So would you be so kind to answer this poll? Salim, do you are you doing them? Somebody's going to put the poll, just give them a moment.
1 second, please.
Thanks, Salim.
There we go.
So here's this poll. What is your role in your organization? Just interested in getting a chance to take a look.
Sorry, Beth, I was emailing the approximately 700 people who were not able to get into the webinar today.
No problem.
We had 1,000 people that were, for everybody who's on the line. So we know that there's some folks that are bummed that they couldn't get in. So please let your colleagues know. We'll send out more information.
So if we can end the poll if you want, or
okay, sure. And then I'll share the results.
Awesome. Here we go. So so if you take, so I know that as we had we thought, there's 145, 64% are line staff. We have some supervisors, so I want to welcome you supervisors, and I want to welcome you managers as well. And we have 5 deputies. So please, I hope that this information is helpful for you. And for those that are supervising others, we will be doing more trainings for managers and supervisors. So please keep a lookout for that. So I want to start out by really addressing some of the complexities of what's happening. And specifically, we all know, right, that it's the virus itself is incredibly complex because, and it's certainly invisible, which is sort of it's really unusual to have an invisible threat. So that's also a unique aspect of the virus. And just as the virus is affecting lungs, is clearly for some just really injuring people, and to the point where unfortunately there are increased deaths. We are also having significant psychological and social triggers, symptoms, issues, responses that are coming up. And that's what I want to address today. So let me quickly tell you that if we started a threat 0, which is a virus, the complexity of this is the most unique one that I have ever worked on. And I'll tell you why. So we all know that survival and illness certainly is a piece, right, of why it is that we are feeling scared, anxious, threatened, worried. But the other part that's sort of interesting to me is other people have now actually, and it's invisible other people, so virtually any other person could affect us, and not that they would consciously or purposely, but they could affect us, right? They could actually give us unknowingly the virus. So other people now, that's a very, very interesting thing, because we are literally, I've never had the experience where in my life I stayed away from other people because of a danger. Resources are clearly are not adequate, so that's another stressor. From masks to hand sanitizers to toilet paper, which we will address later, because that one fascinates me. As a psychologist, it fascinates me. And then there's other issues, of course. We have some global issues like finances. A number of our staff and personnel that are thinking about retiring, they may very well not be able to as a result of what's happened with the financial markets. Many people, millions, have lost jobs within a few weeks, a period of time. I mean, it's incredible, and it's impacting everybody's lifestyle to such a degree, something we also have never experienced. And of course, to get you more depressed, which my intention is not to get you depressed, my intention is to educate you. There's an unpredictable and uncertain future right now. So some of the anxiety that we're seeing is also growing from the fact that we cannot predict when this is going to end and what it will look like when it does. So if I can add now another perfect storm, and then I promise you I will be more uplifting. For direct service providers, here's what I'm hearing from the direct service providers and their managers and supervisors that I've been speaking to now for the last 3 weeks. I work nationally, so I'm speaking to agencies all over. This obviously the significant increase in workload is, and that's already coming off of a gigantic workload. So this workload is potentially not only unsustainable, but is incredibly problematic. Also, I know that you will have a very different clientele that will be largely coming in to you. So that's also an adjustment. I'm also hearing about the social distancing, the isolating that is creating increased stress in families, especially in at-risk families. And some of these at-risk families are not even going to know to reach out, or they're not comfortable, or they're too ashamed to reach out. Again, we're dealing with a very different demographic, as you well know. I have a thought about the term social distancing. I really wish they had, whomever made it up, would have called it physical distancing. I think physical distancing would have been a more accurate representation of what it is we're doing, and it wouldn't imply that we are not allowed to be social. Because the truth is it's very, very vitally important to be social. What we're not able to do is to be physically close to each other right now. So I believe that is unknowingly has also created the term has also created some anxiety and discomfort. Obviously, safety needs are very, very important, and they're still exceeding resources, both with first responders, with second responders like yourself. It's quite stunning to me and unfortunate. Staff are reporting to me so far what I'm hearing nationally, and this is anecdotal, is that not only are they absolutely exhausted, but they're experiencing an uptick in secondary trauma. And if you guys don't know what secondary trauma is, that is the trauma that service providers experience. So it's just by either witnessing or working with individuals who actually are also traumatized. So in other words, secondary trauma is sort of the contagious part of getting somebody else's trauma, picking it up, kind of experiencing it. Major uptick in burnout, and then we are seeing attrition. Now, attrition, I'll be honest with you, concerns me. I've talked to a number of counties specifically that have individual service providers that have actually, some actually have the virus, others don't, but they're now in quarantine. And so there's a shifting, a kind of shifting change continuously now on even being able to manage the work. When we end up losing some unfortunate, we're not able to have some staff work for a while. Also, there's rapidly changing communications I'm hearing that is very, very frustrating. People are reporting, protocols are changing sometimes daily. And another major piece that we will have a chance to talk about is that focus and productivity are greatly reduced right now. And juggling work at home is a larger task than most expected it to be. So we'll have a chance to discuss that more. One of the pieces that one of the messages that I'm trying to kind of roll out nationally is that this is a time during crisis that we must become workforce trauma informed. We must, and many of you know that term from social services and behavioral health, where we see our clients or our customers and we know that they have been traumatized, and we try to work within that trauma. Being workforce trauma informed is an acknowledgement of leadership and of you with each other, that the workforce is also potentially traumatized right now. And we have to be able to address that along with the other issues that are going on. So there's a difference between doing your tasks. This is what I just said to a couple hundred leaders today. I think we had actually almost 250 from 300 from yesterday and today, is that there is a difference between task management right now and what I call people management. So there's a difference. And the workload is still there, but the emotional, psychological needs and social needs have changed significantly in the last 3 weeks to a month. So let me talk a little bit just about, there needs to be an awareness. If you're looking at being workforce trauma informed, you must have an awareness of what is pandemic trauma, and then how is it re-traumatizing, potentially re-traumatizing some of the employees. So what I mean by that is that many of us go into these fields, into these helping fields, because we actually have histories of trauma and we want to give back, or we want to make a difference, or it's the way in which we've even helped ourselves heal. So I say that because some of what's going on is also re-traumatizing from old stuff that may have happened to us in our past. The other thing that is part of being workforce trauma informed is understanding that you need to be in service to yourself as well as others. And we in human services tend not to be very good at that. We are wired, actually, which is sort of interesting from the neurosciences, to be very outward focused. In other words, it's much more comfortable for us to be in service to others than it is to actually have self-care, be in service to ourselves. It usually creates a tremendous amount of not only distress sometimes for some of us, but guilt, discomfort, and a lot of us are not good at it. We never learned it, and we're just not good at it. Something to keep in mind, because under these circumstances, being good or not good, we have to learn. We have to learn in order to maintain our resilience right now. There's also a very different emotional presence that is going on and needs to go on at work. And when I mean emotional presence, what I mean by that is that wherever and whatever you do in human services, whatever job responsibilities you have, whatever classification or position you have, this is a time where everybody needs to practice an emotional presence. And what that means is that there needs to be an increased amount of empathy. We have to inquire and ask our colleagues, our staff, if we're managing them, our friends, our family, how are you doing? Are you doing okay? And we then need to listen to how they're doing. We need to also share ourselves about how are we doing. We need to create a more of a vulnerable presence for some, because many people don't share with us because we don't share with them. We also need to remember that everyone is affected. So if you're finding as a line staff member that you're noticing changes in your boss or your boss's boss, that's because they're also traumatized. So everyone is doing the best that they can do right now. I'm going to say that again. Everyone's doing the best they can based on what they have and what they know right now. But what happens to us is that when we have this kind of a crisis and threat, is that we will sometimes go back to bad habits. We will go back to figuring out how we can defend against all of the anxiety and the fear and the discomfort that's coming up, not to mention other pieces that might be coming up for us. Also, it's very important, what's being reported so far that I'm hearing nationally is those teams that are meeting, and they're meeting, doing virtual presence, so they're having meetings, either daily or at least 3 times a week or so, are feeling and stating that they feel more connected to each other. They feel included as a team, where the manager or supervisor is coming on, even if it's for 10 minutes. Now, I know you have meetings that are task-oriented that might be for hours, but for these are just the connection, being able to spend 10 minutes, even in front of meetings, to be able to say, how's everybody doing? Anybody want to share? Any fun things you guys have figured out to do, with your families, while you're home, whatever it is, so that you are helping to create connection. The other thing too, it's very important, is to allow people to debrief, meaning that right now, some of you and some of your teams need to really talk about the emotional and the social impacts of this. And sometimes that's also a great conversation you can have, put some time aside with your teams. There is a unique piece here too that I have never seen, and that is there is right now a merger between our personal life and our professional life. in that merger, which is what's fascinating to me, is that if you think about going to work, we go to work and we kind of put on whatever mask. We can have a horrible, horrible time at home. We close the door at home. We drive or take public transport to work or walk, and we come into the office with a certain type of, I'm going to use the word mask, but it's not necessarily disingenuous, but it is certainly our professional being kind of comes into the office. For the first time that I've ever seen, one's professional life and one's personal life, your personal life is now merged. So what's happening? What's happening is that I have meetings all over, and I'm speaking to people while they're holding their children. I'm speaking to people while the dogs are running past. I'm speaking to people while somebody doesn't know that they're on Zoom and someone in the family says something inappropriate. And all of that has to become okay. All of it. We cannot control that. And so now here's the good news about it though, we're all in the same boat. We're all making these kind of funny, unusual experiences, and it's all happening to all of us. So I say that because there needs to be room to hopefully adapt to that. Also, it's very important during this time to know your resources and to know where your supports are. For counseling, usually counties have employee assistance programs. If you're needing to take time off, you need to know how you can contact HR if you're not well, or you talk to your supervisor if you're not well and need to talk to someone about that. So I want us to talk for a moment about some of the psychological responses. The spectrum is so wide. If you take a look at just some of these responses here on the chalkboard, you can see they run from denial to obviously feeling out of control, great amounts of uncertainty. Many, and I was saying this earlier, many people who are home and they don't necessarily are either a home alone or they're home with one other person that they may not feel that comfortable with. They feel isolated and really alienated. So there's some of that I'm hearing. The invulnerability myth, that is something where I don't know what age group I have out there, but for many of my lovely millennials, which I love millennials, you're at the age that you still are, many of you are feeling invulnerable unless you have some health issue that you've experienced or some sort of a trauma that you experienced. So I say that because this is a gigantic change for some generations. It's a change also for the generation even coming after that, to understand that, we actually are vulnerable, and the invulnerability, in fact, is a myth. There's other pieces like humor, optimism, competition. We can talk about competition when we get to toilet paper. And there's something else, and I don't know if you guys know this German term, is called Schadenfreude. And Schadenfreude is a term where some people actually are getting delight out of other people's pain and suffering, which is you guys can all go, oh, that's terrible, but that is very true. Sometimes people just get a delight out of other people's suffering. We know there's hoarding, and I've talked to several counties, actually the county elected officials in several counties who have said they've been very concerned about violence at certain points. So as you can see, it's a wide spectrum of responses and feelings. Now, there's a piece that's important though. If someone has a pre-existing condition, either in a psychological, mental health condition, or a pre-existing physical condition, whether it's autoimmune disease, it's some other diseases or illnesses, then what happens is that we actually are, with all of this distress and stress, there's a higher likelihood that we could exacerbate conditions. In other words, something that may be in remission could end up going out of remission. Or if you're taking medications for anxiety or depression, you may need to talk to someone, your physician, about what it is that you might need, and if you're struggling in terms of even medication regimen. So I say that because all of this sort of is big. Now, some people are already grieving, and then on top of this, for myself, my mother passed away several months ago. I have hardly gotten started in being able to to deal with my mother's death. And now this is compounding, you know, already a grief process. So I'm noticing some of that struggle as well. So I'd like you to, with this poll, if you don't mind, and you can put as many as you want, which reactions or reaction have you been experiencing? Meaning, and you can put, it's multiple choice, so you can do, you know, 1 to 5 if you want, or just the ones that you see that you have been experiencing, personally experiencing. And notice that some of these reactions are behaviors like difficulty, reduced productivity, right? Not being able to sleep. These guys are still answering. We've got another 100 to go if everybody's going to want to weigh in. Responses are still going.
Oh, okay. I'm gonna end it.
Okay.
Okay.
All right. So here's what we've got. Take a look. So as you can see, what's reported at 62% is exhaustion and sleep difficulty, which is a problem, guys, and I'll tell you why. And I'm having it too. Nancy and I were speaking about this afternoon. Sleep is necessary for a couple reasons. One, it's restorative to the body. So physiologically, it's very restorative to the body. It's really important for us to sleep and to have a certain depth of sleep in order to feel rejuvenated. So you guys don't be surprised how exhausted if you're exhausted. The other piece is that there's no distress in sleep. When people are sleeping, I learned this a long time ago, there is no distress in sleep. There's no pain in sleep, right? So we get to have some time off from the reality of our lives when we're sleeping. So if in fact we're having problems with sleep, it will interrupt both physiologically and our bodies, and it will interrupt our mind significantly. Now we see focus on difficulties, reduced productivity. This was very important, by the way, for leaders to see this, that this is, and by the way, they were reporting it too, a reduced focus difficulties and reduced productivity. And then of course, anxiety, anger, frustration, not at all surprising, and some sadness, some significant sadness. Thanks, Nancy. So I'd like us to talk a little bit for a moment about maladaptive coping. And I don't know how many of you can relate to this, but I have eaten more food in the last 3.5 weeks that I've been in my house, because I started very early on. I am immune compromised, and so I started right when we started to hear that there was going to be a problem. So I have eaten more food and eaten food that I don't usually eat, and I don't care. So, which I usually always care. So, so certainly self-medicating during times of stress is very, very common. Now, some people may be now drinking a little more, they might notice, or using some either prescribed medications or other drugs. All of these are in some level maladaptive. And part of the maladaptive side of it is because each time we do something that's going to numb us, then we're not dealing with it emotionally. And when you're not dealing with something that is emotionally inside of you, it just stays there and it grows. So that's just a piece to think about. Information consumption. Now, overconsumption. I don't know if you guys are feeling this way, but I certainly am. I counted, initially, I was reading the news 25 times a day. And the funny thing is that it was getting reinforced because there were changes each time I read the news, which actually reinforced me reading it more. Now I've decided that I will look at the news, and I read news, I don't watch it, but I look at the news 3 times a day, and that's it. And I seem to be able to still keep up without dousing myself with it. Some of us become more controlling. The more out of control we feel, the more controlling we become. Some of us even become more micromanaging. The more out of control we feel, then we start to micromanage. If you're, and be very, very aware of that, by the way, if you're starting to really kind of look at a lot of so much detail, or kind of coming down hard on family members or on your colleagues, or if you're supervising on your supervisees, be very, very aware of that. Not at all unusual for us to use those kind of defensive behaviors that are, and coping that we are used to, even if we worked on them really a long time, that we're used to going back to. So I was saying to you that there's a difference between social isolation and physical distance. I've talked to some individuals who are just telling me that they are purposely socially isolating, and I'm very worried about that, because, and they just say, I don't want to be talking to anyone, because that breeds depressed mood. And we are social by nature. We are wired to be social. And it doesn't have to be a lot of people, but we need what I call lifelines. We need people that will check in with us, make sure we're doing okay. And we need people and we need to check in with other people as well, and be able to have those conversations. Whether it's on the phone, it's better. And by the way, text doesn't really do it in this sense, because we are not having enough interaction, in-person interaction. So these are times perhaps that you would consider picking up the phone or going on to Zoom or FaceTime. Now there's another piece too, and that's this resistance and ignoring medical advice. So this is quite a stunning process and problem around that's maladaptive, actually. And it's not only harmed people because they did ignore and resist, but it has harmed, it's not only harmed the individuals that were resisting, it's also harmed others that were and came in contact with them, unfortunately. I was fascinated by watching the resistance, and I'm still seeing it. Actually, I live in Orange County, and I still see it. We were driving to pick up some food the other day, and I noticed a whole group of 6 individuals. Now, there weren't a lot of groups that were together, but these 6 individuals that were so close to each other, and you could tell they were friends. They were friends. They were not siblings. So it was really quite concerning. But there's reasons, and there's reasons for that as well, in terms of the sort of resistance and ignoring medical advice. Some of it is that we don't want to be excluded. So if we're part of a group and the group kind of is doing what they're doing, it's going to take some energy to be able to say, you know what, I don't, that's not really what the medical professionals want us to do, like knock it off. It takes a lot of energy. It also can be, and then we take the potential, have the experience of maybe being shamed, right? There, people are going to laugh at us, they're going to say something. There's also that myth of invulnerability that I was talking about. And there's contagion, or what we call conformity. Conformity is just where unconsciously we end up doing something. We're not even necessarily in awareness of it, but we unconsciously do something because it creates anxiety for us if we don't follow the group. So it creates anxiety if we don't follow the group. So let me give you an example of a video right now. This is a video, and it's actually was a research study. It ended up going on to Brain Games in 2017, and it shows how we are wired to conform, meaning that our brains are wired to try to fit in, because our brains are wired to survive, which we'll talk about when we talk about the neurosciences. So so let me play this for you and see what you think.
To answer that question, we set up a hidden camera experiment to see if this woman would stand up at the sound of this tone, simply because everyone else is. You might be thinking you'd never go along with this. Or would you? After just 3 beats, and without knowing why she's doing it, this woman is now conforming perfectly to the group. But what happens if we take the group away?
Elaine, please.
Okay, now she's alone. The crowd is gone and nobody is watching her except our hidden cameras. What do you think she'll do? She's now conforming to the rules of the group without them even being there. Now, watch what happens when we introduce another outsider who doesn't know the rules.
Have a seat and they'll be out of the circle. Thanks so much. Everybody was doing it, so I thought I was supposed to.
Think she'll teach the new guy what to do? We kept the cameras rolling as more unsuspecting patients arrived. Slowly but surely, what began as a random rule for this woman has now become the social norm for everyone in this waiting room. Here to explain what's going on in their brains is Jonah Berger of the University of Pennsylvania.
This sort of internalized form of herd behavior is part of what we call social learning. Starting at a very early age, when we see members of our group perform a task, our brains literally reward us for following in their footsteps.
When I saw everybody stand up, I felt like I needed to join them. Otherwise, I'm like excluded. Once I decided to go with it, then I felt much more comfortable.
Conformity is how we become socialized, but it can also cause us to develop bad habits or repeat past wrongs.
It's why even this rebel, who wasn't standing for any of this nonsense, eventually joined the ranks. And the only thing more shocking than seeing how easily conformity affects the way you act is that similar forces are subconsciously shaping the way you think right now.
So it's sort of interesting, isn't it, that if we're wired to conform, then the likelihood is that we may be conforming in different ways that actually are not even in our own conscious awareness. I'm oh, sorry guys. So I wanted us to do a quick poll here. I want to have a moment for self-reflection. Which maladaptive behaviors can you identify that you might be doing? So one is eating more. Another is taking in too much news, information, needing more control over my environment, socially isolating, embarrassed to wear a mask and or gloves.
Beth,
Yes.
we needed a all of the above option.
Oh, yes. Okay. But they can do all of them if they want.
That's true. That's true.
So if you have all of the above, do all of the above, guys. You're absolutely right.
And then somebody also wrote eating less.
Oh, yes. Thank
Yep.
you. Boy, I didn't even think about that one. That tells you how focused on food I am.
We have another one. I'm trying to do too much.
Yes.
Mm-hmm.
That's great feedback because we can add them.
Mm-hmm. Okay. Looks like things are slowing down. If you haven't gotten all of yours, I'm going to end the polling. We've got too much multitasking, over responsibility for others, can't stop cleaning.
Mm-hmm. Boy, I wish you could come to my house, the individual that can't stop cleaning.
Have no idea what to prioritize. So too much social media.
Excellent. Yes. So thank you for sharing ones that you know are already somewhat maladaptive. And by the way, that some of them are not maladaptive on the face of themselves. They are based in how much we're doing it. So everybody has to eat, but if we're eating too little or we're eating too much, then we can end up compromising our health in either direction. So really or we sometimes want to avoid people and not hang out with people. But if we are social isolating in a way that we know is not really healthy for us, then we're not taking very good care of ourselves. The embarrassment to wear a mask and gloves is 32%. And I really appreciate your honesty around this, because this is in other cultures, people wear masks all the time. And it actually is not only is it a common part of the culture, but you actually are looked at funny by not having a mask. And I have a mask, and I started very early on wearing it when no one else was. And I have to tell you, first of all, it took me so much energy, like, not to take it off, because people were staring at me like I had two heads. And it was very, very uncomfortable. I am now used to it if I do go out. But it took me a few times when I had to go out to really manage that. Thank you all for your honesty. I appreciate it. So we can end the poll.
I did. You might have to.
There we go. I got it. Thanks, Nancy.
Okay.
So can we move to the neurosciences for a moment? Just for a few. I try not to talk too long on it. Some people enjoy learning about the brain, others don't. Those of you who've heard me before will notice that this is a very similar discussion we've had before. If you were in a secondary trauma course with me, then you know this will be familiar. So I'm going to talk about our brain in three specific locations. And this is not your real brain. This is just a simplified model to explain what areas of our brains are actually being affected as a result of the crisis of the coronavirus and the pandemic. How are we affected, and then why it's happening? So I'm going to talk about these three different parts. This part is what we call the neocortex, or better known as the new brain. And human beings have the largest neocortex of any animal. 76% of our brain is made up of the neocortex. But what's interesting too is that we have this part where that blue area is in our brains. That's also what we call the prefrontal lobe. And this part of our brain actually is where it is that we do a lot of our planning. It's how we plan out. It's how we can work timely. It's how we organize things. It's that area where we end up being productive. And so for those of you who are noticing a real difficulty with productivity, what can happen is this. What happens is that when information is coming in through your eyes, your nose, maybe you're tasting it, or you're hearing, or you're touching, right? Information, and our bodies are in more of a resting state. Information will come in, and it will just stay in this area, and then it will travel down into some neural pathways, and it will go right about here to the hippocampus, which is called our memory center. It will go into a memory center, but it will come in sort of a more synthesized and rational and reasoned information. Now, information that comes in through the red part, what's called the limbic system, when it comes in, again, through the ears, the eyes, everything that's happening to us right now, right, that we're hearing constantly, or reading, or seeing, if it comes in through here, it will come in through what we call a threat center. And that threat center, which is called the limbic system, what will happen is it will also get registered in our hippocampus, but it will get registered as a trauma. It'll get registered as a significant threat to our survival. So usually what happens is right now, our brains have a lot of glucose and oxygen just running around our brains. But when a significant threat comes in, what will happen is that this will go what's called offline, and more of the oxygen and glucose will run to here, which means that it makes it more difficult. We need that oxygen and glucose to think clearly, and it will make it more difficult to think clearly. Now, once we end up triggering the limbic, we also trigger something else, which is more physiological. Our body will get ready to fight, freeze, or flee. We will be ready. Human beings by nature want to survive, and if we feel a survival threat, we will be ready, vigilant on it in order to save ourselves should we need. Right now, what's happening is that we are in what we call chronic vigilance, a chronic vigilance state. Let me show here, a chronic vigilance state, and I'll talk a little bit more about that. So if I talk from sort of more of a neuroscience terminology, what happens actually is that when we have our neocortex working, right, that's 76% of our brain, we're going to feel emotionally regulated, we're going to have some level of self-control, we're going to be making decisions that are probably in the best interest, hopefully, of our lives, of our families, of ourselves. And when we need something and this gets triggered a little bit, that's fine. Even if it's a strong emotion, we still have the capability to take action. But what happens if this goes offline? What happens if there's just too much and we are flooded, guys, and there's just too much coming in and it's too scary and it's too threatening and there's too much anxiety? Then what happens is that we begin to become reactive and our action center, which is growing from here, decreases. So if I say that again, when we are, and it's called loss of top-down management, because here's the top, right? The neocortex, and then we go to the limbic, and then we go to here where our reactions and reflexes and our behaviors, we actually will sometimes behave in ways that you don't even expect yourself to. People will look at you and go, you never do those kind of things. And part of it is because it's very hard for many of us right now to stay and have enough oxygen and glucose in this area where we would be much more rational and logical. Now, what's interesting is that this is also a problem for those of us that are working, because this is exactly where we can focus and concentrate, is up here in our neocortex, and it's exactly where it is that we have our productivity. So you need this functioning in the neocortex in order to really maximally be productive and your maximal concentration and focus. Well, I wish I could end there, but I can't, because the body is also affected, right? So the body is affected as well as the brain is, once we know that there's limbic activity. The brain will actually do what's called what we call it the sympathetic nervous system will actually get kicked off when, in fact, we believe or our neural connections have responded as if we need to fight, freeze, or flee. Now, many of you know that feeling because something might have happened where you felt some sense of danger, and all of a sudden you start to sweat. Your heart rate goes up. You might feel like you have some extra energy. All of that is the sympathetic nervous system. Now, that's fine if we have a threat that is right there, we take care of it and we move on. But right now what's happening is many of us are in what we call a vigilant sympathetic nervous system state. Eventually, with the vigilant sympathetic nervous system state, not only does it take a lot of energy, because with that, we also get secretions of adrenaline in case we're going to run or fight, and we get secretions of cortisol, which is a stress hormone. So this whole process, when we need it, is great, and then afterwards is exhausting. If you're in a vigilant state of this, of the sympathetic nervous system, which is anxiety, fear, feeling worried, then this will stay on, and you will notice it will impact your sleep, it will impact your ability to be able to get things done, and it will exhaust you. You will be absolutely exhausted even if you've slept all night. You will be exhausted because it's taking so much energy. Now, there's another part of our nervous system that is really the part that we would like to be in, the parasympathetic nervous system, when we are not in some sort of threat. Now, the other part, though, is that sometimes we can be in a threat and we can create and get back into a relaxed, restorative, sort of healing, balanced space. And one of the ways to do that, one of the key ways to do that is focusing on your breathing. It's one of the key ways. So I'm actually going to invite you guys. We have another 35 minutes. I want to invite you to focus on your breathing for the next 35 minutes. And what I mean by that is all you have to do is make sure that when you're breathing in through your nose and out through your nose, that you take all the air out of your lungs at the bottom of your breath. So just take all all of your air out of your lungs at the bottom of your breath. And just focus on that and focus on me and what I'm saying. And some of you actually will get incredibly relaxed and you might even fall asleep. And I'll be happy that you ended up getting a 30-minute nap. So please know, no one's here to judge. But I say that because that is one of the main ways of being able to move from that threatened state to what the state we need to be in to get restorative, which is a parasympathetic nervous system state. So I might remind you as you're going in the next few minutes or, 10 minutes from now, are you still focusing on your breathing? Now, what you're going to notice in your focusing on your breathing is that you're going to have thoughts that are coming to your mind, and you're going to stop focusing on your breathing because the thought's going to take you away. Just when you notice that you've had the thoughts, just go, oh, wait a minute, I've had a thought. Okay, let me go back to my breathing just now. Let me give it a shot with Beth. Well, while you're focusing on your breathing, I'm going to talk about how it is that we need to be adaptive during this time. What I like to call this is adaptive realism. We need to be realistic, but we need to be adaptive. We must be flexible right now, or we will have a complete erosion of our resilience, ability to be resilient, and we will also potentially end up going into some sort of a emotional crisis. And I say that because there are too many things that are changing right now that we need to be able to traverse rather than try to hold something steady. It's everything is moving, as you notice. So another way of doing that, besides focusing on your breathing, is also to look at things from different lenses. So I'm going to offer a few different lenses. Someone has Nancy, somebody has their sound on that's making noise, so you'll know.
Okay, let me see if I can mute everybody.
Yeah, and I'll
I didn't hear them.
yeah, I'm hearing it, but I'll continue. I just didn't know if
Okay, Salim's going to take care of it, which is better because I'm not that great at this.
Thanks, Salim. So let's go back again for a moment and just talk about the value of peering and looking through different lenses. So here's one lens we need to talk about. And one of these lenses is our homes have now become our offices. Our offices have now become our home. So what does this mean when your home becomes your office? And how do you blend that? And what's realistic? What are the realistic expectations of that? And I said it earlier, we cannot divide up our home and our office when we have our families walking around and doing their lives and everybody's home. Not to mention that now many of you who have children are responsible for, I know they're calling it homeschooling, but I don't think that's the right term. I'm going to call it, now you're responsible for having the school at home, which because the homeschooling has a very different infrastructure to it. I homeschooled my children. It's a very big infrastructure. There's a lot of social connection to that, which you guys are not at this point having, and the children aren't having. So I say that because there are so many responsibilities right now, and having realistic expectations about what you can expect from yourself, what you can expect from your family based on the ages of everyone in the household. Some of you are caregiving, elderly parents, all of that. I have not had a meeting yet in a house where something funny or even for some embarrassing hasn't happened. So I can do the funniest one that one of the good ones that I heard was from a friend of mine who was head county council in one of the counties up Northern California. And she was telling me that she was on a meeting, her son was upstairs, she's on a meeting, she's on a Zoom meeting, and all of a sudden they got talking about hot chocolate. And so my friend Stacy says, oh, hot chocolate. Oh, yeah. And all of a sudden her son runs downstairs. He's 13. He runs downstairs. He says, Mom, you mean we have hot chocolate? And everybody is looking in the meeting at him. And everybody just laughed. So I think that we need to adopt some level of humor in some of this. Also, being flexible, we can also be creative during these times. We have to certainly, as I said, be adaptable. Some of us are not as good at practicing self-compassion, but this is a time to really practice self-compassion. Other compassion too, but self-compassion, because we need nurturing, and this is a time where we cannot necessarily even receive the nurturing from some of the people that we usually would, because everyone is so separated. We're finding virtually connecting with teams is very important. That connection is vital. If you're feeling isolated, please, and you're working with a team, please even make a commitment to Zoom people a couple times, a couple times in a day, even if it's to be on for a few minutes during your breaks. Take breaks together. Do a virtual lunch. Do virtual coffee. Also, setting your intentions about how you're going to spend the day is really important, because quite often, if you've noticed, you will start your day and all of a sudden the day is kind of going away from you and you didn't feel like you got much done. So my recommendation is you try to set realistic intentions. Also, many of you from this lens need to figure out how to accommodate the many variations of what a workday even looks like. It does not look like, obviously, your 8 to 5 or your 8 to 6 or 7 or however long you used to work in the office, because you're going to have interruptions and there's going to be things you need to attend to and then come back to. How could any of us feel surprised that we are having problems, even remembering things, or being as acutely aware as we usually are? So I want to stop here just for a moment, Nancy, and see if there's any questions, thoughts before we move forward.
Yeah. So we have people just talking about how it's not easy. 2 children and a husband all in one house can be a lot, or a partner. And there was one comment. Patty asked if you could give an example of self-compassion.
Oh, absolutely. Okay. Yes, I can. So would you like me to do that right now, or do you have any others that you want to?
Let's see. I think that is it.
Okay, so let me give you some examples of self-compassion. Self-compassion is just being kind to yourself. So essentially, you already know how to be compassionate with other people. All you would do is redirect it to yourself. Now, I say that because those of us that go into these industries are really good at being empathic usually. We're really good at being very kind and being very attentive. So part of self-compassion is just attending to ourselves. I can tell you one behavior that I'm doing lately that I don't usually do is I'm taking a lot of baths. I don't know why, but I decided I'm going to take baths. And those are great. It's just like probably the only place where it's really quiet in my house and where I can actually really relax. So there's all different ways to do self-care and self-nurture, but it's different for all of us.
So Beth,
Yes.
a case in point, I have an 11-year-old here with me, and I was not on mute, and she just whispered something about the way I had my other screen was really boring as you were talking. So if anybody heard somebody whisper, "That's so boring," that was not for you.
Ginger, you'll know I didn't even hear it.
Okay, good.
I didn't hear it, but I always like your feedback. It's fine with me. All right, well,
Okay, so we also have another question.
Yes.
When will we talk about how to help children and their caregivers when they are often already dealing with recovery from chronic trauma?
When will we say it again? I'm sorry.
When will we talk about how to help children and their caregivers when they are often already dealing with recovery from chronic trauma? So I think in some ways, what we've noticed, and it's not necessarily, and we're trying to figure out how to respond as well from UC Davis. And I think actually, Beth, you and I talked about this, is how do we help resource parents right now who are dealing with all of this stuff and are have children who have undergone so much trauma already, and then experiencing this, or kids right now who are currently being detained and in this radical time to not be with their biological parents.
Yeah, and we've talked also, I mean, some of the concerns around foster care also in terms of, if someone becomes positive and then the foster parents or the children, if they're positive for the virus, and a lot of upheaval. It's not, I apologize to you because we're not going to address it as much today, but if you take what we're talking about and developmentally move it to the developmental age of the child or the children that you are working with, or being able to help parents and caregivers to developmentally explain things. So one of the problems that I'm seeing is that we as adults can talk about this, right, with our language, and it makes sense to us. We may not like it, but we have a vocabulary for all the distress. We have a vocabulary for some of this stuff. Children don't have that vocabulary. So how can you make it simple so they understand it without scaring them too much? The other thing that Nancy and I have been talking about is that some children are scared to leave the house. They're not, and it's not that we don't want them to leave the house, but they are absolutely paralyzed to leave the house. Well, I think that's maladaptive in my opinion. So how do we explain it? In the early days, that when my kids were younger, I loved explaining it through a lot of art and a lot of pictures and stuff like that. I would explain stuff through pictures and then try to create very simplistic explanations. And every developmental stage, by the way, will need a different type of explanation. I don't know if that helps at all.
Yeah, there's a good conversation going on the chat about compassion and extending compassion to ourselves and others, and how it can be easier with others sometimes before.
So much easier. Well, I want to talk about a couple more different lenses, guys, some lenses that you might find interesting, and then we'll talk about strategies and ways of really helping in terms of being able to get more balanced and to hopefully feel better, somewhat better, or at least to be able to manage. Another lens that we can look through is the anthropology lens. It's like what's the anthropology of human responses? This is fascinating to me. Here's a woman who's purchasing groceries for elderly neighbors, and she's taking groceries around. I'm a little envious because she got toilet paper and I haven't been able to find much, but nonetheless, she's really in service to others, right? We know how to be that. But here's somebody also who did the exact opposite. What he did is he went out, he bought everything he could, he stockpiled everything to resell for profit. By the way, eventually he got so many death threats that he did a public apology. I'm hoping that he also realized that he made an error in doing this, but he did nonetheless create a public apology. But nonetheless, look at those two different ways. While you are feeling threatened, to respond. So it's sort of interesting, right, in terms of human responses. I think we have to, I mean, at the risk of wanting to discuss toilet paper, I'm going to. Why toilet paper? Why did that become, it was just really surprising to me, to be honest with you. I didn't understand it. So I decided to look up the theories on why people chose to hoard toilet paper. And by the way, if you go on YouTube, people are screaming and yelling at each other. They're pushing each other to get the toilet paper. So something happened, right? That people decided at some point that this was going to be needed to be hoarded, that somehow we weren't going to have enough. So here's some of the theories. One is a contamination fear theory, which I thought was sort of interesting, that perhaps we have, bacteria and viruses. If there's bacteria and viruses, we're kind of like afraid of being contaminated, and somehow toilet paper matters. Underlying social concerns and shame around bathroom habits and that sort of thing. A need to feel in control, or at least perceive that we are. And also what eventually happened was it became really competitive. I don't know if you guys became competitive, but I know I became competitive. And I was determined that I was now going to find some too. Took me a while, but I did. There's also sort of a way of, oh my goodness, will we have enough? And if we don't have enough, what does that mean? And also the level of unfairness. And all of these, by the way, create a sense of threat. All of them can feel threatening. So unfairness alone, we are wired to just scan for unfairness. That's how we're wired. So the level of unfairness started to create a tremendous amount of rage that started to go along with the toilet paper debacle. So I'm going to play a quick video for you. Some of you may have seen this video. Franz de Waal gave me permission actually to play this video, because what I want to show you is that we are wired, but so are other animals wired for fairness. And there are responses even animals will have, or these in this case monkeys will have a responses and reactions to fairness. Just a couple minutes.
So a final experiment that I want to mention to you is our fairness study. And so this became a very famous study, and there's now many more, because after we did this about 10 years ago, it became very well known. And we did that originally with capuchin monkeys, and I'm going to show you the first experiment that we did. It has now been done with dogs and with birds and with chimpanzees, but with Sarah Brosnan we started out with capuchin monkeys. So what we did is we put two capuchin monkeys side by side. Again, these animals, they live in a group. They know each other. We take them out of the group, put them in a test chamber. And there's a very simple task that they need to do. And if you give both of them cucumber for the task, the two monkeys side by side, they're perfectly willing to do this 25 times in a row. So cucumber, even though it's really only water in my opinion, but cucumber is perfectly fine for them. Now, if you give the partner grapes, the food preferences of my capuchin monkeys correspond exactly with the prices in the supermarket. And so if you give them grapes, it's a far better food, then you create inequity between them. So that's the experiment we did. Recently, we videotaped it with new monkeys who had never done the task, thinking that maybe they would have a stronger reaction, and that turned out to be right. The one on the left is the monkey who gets cucumber. The one on the right is the one who gets grapes. The one who gets cucumber, note that the first piece of cucumber is perfectly fine. The first piece she eats. Then she sees the other one getting grape, and you will see what happens. So she gives a rock to us, that's the task. And we give her a piece of cucumber and she eats it. The other one needs to give a rock to us. And that's what she does. And she gets a grape. And she eats it. The other one sees that. Rock to us now, gets again cucumber. She tests the rock now against the wall. She needs to give it to us. And she gets cucumber again. So this is basically the Wall Street protest that you see here.
So many people have asked me at the end of this experience, they feel badly because they're not sure whether or not the capuchin monkey ended up having the opportunity to have some grapes. And not only in the research was so fascinating, not only did the capuchin monkey offered grapes afterwards, but the other monkey is the one that offered the grapes to share the grapes with the capuchin monkey that got the cucumber was a girl. So they actually offered to share, which really gives us an idea, if we think about in terms of our own wiring, is that if we are not in threat, our behavior will be much, much more inclusive than when we are experiencing threat. So I want us to talk somewhat about more about self-care and other care, but self-care, if you don't mind. Here's some strategies to build resilience and psychological immunity. And one area that's really interesting for me is that, you know, as a psychologist, we are trained to not only learn about our own self-talk, but to help our clients understand their self-talk, what it is that we are saying to ourselves repetitively. And quite often, and we are wired actually to come in even as infants to be negative, to scan our environments. It's kind of unfortunate. So we have to work against that. But right now, specifically, what we are saying to ourselves, we are scaring ourselves mercilessly. I mean, we are. And some of it is fair to scare ourselves because it is a scary time. But the amount of times that we're scaring ourselves, if we already know we're scared, why are we looking around for validation that we have to keep staying scared? So one of the things I tell people is to be really aware of your self-talk. Be very aware. By the way, if you have stopped, you might want to continue your breathing, because we have another 15 minutes and you could still continue on with your breathing. So focus on your breath, but also listen. What you're saying that might be igniting. Now, I'm not saying it's not a horrible time, because it is a horrible time. I'm in no way saying that you need to be Pollyanna and somehow pretend it's not. It is a difficult time. But one of the pieces that I like to explain is that there's a number of things that are impacted that are important to understand. One, if you're waiting to feel motivated, this is not a time usually that we will experience much motivation. That doesn't mean we can't get things done, but we need our determination rather than motivation. We need also our willingness to do something, and we need our determination, and we need to intend to get something done. I was telling Nancy that I have built a number of these programs to be able to offer you guys, and it's taking me 3 times as long to be able to really get them the way I want. So I say that because I'm trying to be very self-compassionate and be like, that's okay. That's just where I am right now. There's a level of acceptance. Assessing emotional states, ask for help if you need it. Please ask for help. Please ask for help. It is better to get help earlier on if you need a counselor. A lot of counselors are now doing virtual therapy, virtual counseling, and what's wonderful is that all the insurances are now allowing it. So if you check your health insurance, or you want to go to your employees assistance program, or you want a family member or a colleague that you're worried about, please notice and be aware of people's emotional states and your own. I think distraction's great. We watch a lot of things to laugh including a lot of comedies lately, but play, art, music, media. I've seen people do cool virtual social events. I've seen people do choir on Zoom. I've seen people do virtual lunch, the virtual coffees, virtual happy hour, where I guess everybody's just kind of getting drunk together, but not together. All different cool things. So I think it's very exciting in terms of being able to create something that might not be exactly what you want, but at least will be some sort of a salve that could help feed us a little bit with some of the social stuff and some of the laughter and some of the even a sense of some normalcy that we need. I told you earlier, mindfulness practices are incredibly powerful. They're really very powerful. Nancy and I are talking right now about seeing if we can't create some YouTube videos of a number of meditation practices that I can offer you guys that you can do during the day, during a break or lunch. Learning something new is very powerful too right now. Learning something new is great. Any body time you can do, any movement you can do. Nature is a very powerful parasympathetic nervous system inviter. It will invite you into nature. A newer research just shows even having a plant in an office desk helps in terms of relaxation. 2 lists that I recommend people doing is a gratitude list and a to-do list. Now, the to-do list is probably stuff that you'll never end up doing anyway, but nonetheless, it's intentional. But the gratitude list is to remember that we are having a unbelievably horrific experience, most of us. And sometimes in some days, it's going to be hard to find what we might be grateful for. And it's very important. If you even look at the Dr. Emmons research from UC Davis, his gratitude research is very, very powerful in terms of being able to maintain outlook and maintain resilience. And then there's another part, is just accepting. How is it that we can accept what we can control and what we can't control? How do we accept that? What can we control and what can't we control? And so I try to build this in terms of what is out of our control right now. There is a lot out of our control. If you guys just take a look at this is some of the stuff. There's a lot more that I just didn't have room to put on, but a lot more. But there's also a lot of things that are still in our control that I believe that we are so overwhelmed by what's not in our control that we may lose sight of what is. So let me give you some examples. The ability to kind of get ourselves in a more relaxed state is in our control. Put on a YouTube. There are thousands of even meditation YouTube videos that you could even use, and there are apps that I'm going to provide you at the end. see if you can't get your body into a relaxed state and practice it. Create social connections if you need, ask for help if you need. All of these are in our control. How I spend my time at home is not fully in my control, and neither is it in yours, but there are some minutes of time perhaps. Problem solving, self-care is in our control. We might not be great at it, but we can make a commitment during this period of time to learn it. Protective practices to make sure that we practice safety if we're going out, that we make sure if we're bringing stuff into, we have Clorox where we just Clorox down all the food, everything that comes in. I'm highly immune compromised, and our family is just committed to doing that. My attitude, your attitude, that is definitely in our control. Amount of news consumed, our own thoughts, feelings, behaviors, adapting, kind of be deciding that we're going to be adaptive and replace this need to know and predict our futures with just kind of being able to weather the seas. If we were on a sailboat, just to be able to weather the seas right now. And also one thing that I really like is that we have a lot of control right now of our office attire, which I don't know about you, but I've just rarely had before. In other words, I'm wearing sweatpants. I know I put on a nice sweater every day, and underneath are my 2 pairs of favorite sweatpants that I will pick and choose from. Matter of fact, I was eager to know, are any of you wearing sweatpants or jeans or shorts, or is it only me? So could we do a poll for a moment?
Hi, Beth. I could put one together real quick.
Thanks, Salim.
No, I got it.
You got it? Okay.
It's showed up. Oh wait, poll is closed. Relaunch polling, sorry. Here we go.
There you go. So please be honest. How many, make me feel better, please. Tell me you're wearing things, wearing relaxed stuff underneath. Shorts, jeans, sweats, something that you wouldn't usually wear. Oh, look at that. I am feeling so validated, Nancy. It's 129, 130 in either shorts or jeans or sweats. No, but I will tomorrow. Absolutely. My 8% that has not been wearing shorts or jeans, please do. None of the above is making me very nervous. There are 16 people. I don't know what you're wearing, but I'm not sure we want to know. Or if you're wearing anything.
Okay, I'm gonna end the polling.
That is a joke, guys. It's a joke. Okay, so take a look at our, so see now, one thing that makes me feel good is that, I don't know about you guys, but something really offsets, even though we have dropped some of our mask that we know that we would usually perhaps have, or our personality, our professional personalities. A mask isn't a good word, but professional personalities. I hope you guys really have taken to dressing in a way that you can be comfortable. And it seems like a lot of you are. So that's a great, thank you for that. It was very validating for me, and I needed that, so thank you. We can stop that one.
Okay. I also, well, I can chime in at the very end.
No, chime in, go ahead. If you want.
Well, we're getting quite a bit of folks writing in about a desire and a need for having follow-up webinars on this, and not just on this topic, but on how to actually provide direct services to children and families, so virtual client engagement. And so I just wanted to let everybody know that we will be doing that. This is just the first on many series of classes. So this one really is, you know, it's the navigating the psychosocial impacts and how much the desire is to sometimes focus on the client first. And so there's an interesting conversation about self-care versus providing this for direct service, or providing this for clients and families.
And can I make a statement about that, guys?
Yeah. Yeah.
If you don't take care of yourself first in crises like this, you will find it incredibly difficult to take care of your clients. And I say that because this needs to be the first discussion that we have. And it is the first discussion of many, but this needs to be the first discussion. Because you have entered something that all of us, we're all entering into something that it's uncharted. We don't know about this, right? We're all trying to figure it out. We don't even have we don't even have a good compass. And so you guys need to be able, in order to be productive, in order to have enough energy to be able to do your own interventions with families and with the children, you need to be taking good care of yourself. So this is not this is, usually I will joke in my secondary trauma classes and I will say, oh yeah, you know, keep working on it, keep working on it. I don't think that we that are doing this work, that are in service to so many people, this is not well, I'll work on it later. This is you need to figure it out now. That's my best opinion. I'll get off my soapbox, so. And I do agree with you, by the way, those of you that are chatting about it, you need you need to be able to talk about the children, the families, and how does you manage this stuff with children and the families. I completely agree, hoping that that will be also reduce some stress for you. So I thank you. We're about to end. I thank you. I'm hoping we will get through this together, inspired, motivated, and unfortunately, but and proudly in remembrance of all those that we have lost or will lose to COVID. I want to provide you with some great apps here, and you're going to receive this. Provider Resilience apps. This app is fantastic. It was built by the military, but it is fantastic in terms of understanding burnout. You can do questionnaires on burnout, secondary trauma. You can, and it'll graph it for you. Center for Healthy Minds, if you're interested in learning more about mindfulness practices and meditation, it's probably the best one. It doesn't cost anything, and it's from Richard Davidson, who is the head of the Center for Healthy Minds. He's a longtime researcher on mindfulness and on neuroscience at the University of Wisconsin in Madison. Here are some other apps that you'll have as well that you can use. If you feel like you're really having difficulty with trauma, this is one of the better apps. This is one of the best apps, actually, that the VA created, PTSD Coach. And then here are some resources. And if there's crisis, there's also a trained crisis counselor that can be called on this 800 number. Last couple questions, thoughts? We have a couple minutes.
We are getting a lot of, just a lot of appreciation for you, Beth. This has been really fabulous. People are excited, and they want you to go back to the app information page.
Which app? Absolutely.
Yeah.
Oh, absolutely. I'm going back, guys. There we go.
And I will, this is a great reminder, because I told the folks who attended this yesterday that I would put these apps in the email that I send out with the recording. So I will do that. Thank you for the reminder. And then we have lots of people who want the PowerPoint. We're not going to distribute the PowerPoint in and of itself as a PowerPoint document, but we will send a link to the recording so that you can watch the recording, but we won't send the PowerPoint as a separate document. And we will be hopefully doing this, since there was so much great participation. We will be doing the same one hopefully next week.
I want to thank all of you for spending the time with me. I don't take it for granted that you guys are incredibly busy. So to put an hour and a half aside is not only meaningful for me, but I really do hope that all of you found some value, and we know there's a lot more to talk about. This is only the first 90 minutes of a lot things to talk about. I also hope that each of you stay safe, and that you stay well, and that you please take care of yourself so that you really are able to take care of the children and the families that you so beautifully serve. I thank you again.